This podcast is brought to you by Delta Neural Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneuralhealth.com. Hey everyone, welcome back to the show. I'm your host, Dr. Joe, and today I am excited to be joined by our guest, Dr. Amanda Smith of Radvocacy Wellness. Thank you for joining us today.
Thanks for having me, Dr. Joe.
Of course. It's always Dr. Smith is we go way back, back to chiropractic school, picking each other's brains, pushing each other in different ways. And so I'm really excited to have you on the show to talk about what you're most interested in today.
Thanks, Joe.
Which, by the way, is specifically, like we said, female athletes or training the female athlete, but it's going to be a little bit, like you said, more specific than that. But before we get into too deeply into the topic, can you just let our audience know a little bit about yourself, your background, and why you're here speaking to us today?
Totally. I ran cross country and track in undergrad at University of Alabama in Huntsville. We were a Division II program, and I had a ton of injuries. I had 6 stress fractures, which is obviously pretty abnormal. And I felt like I could not find a provider to help me figure out why I kept getting injured until I met a chiropractor. I was going to like nutritionists, athletic trainers, MDs, PTs, the strength coach at the school, like all the things. And then someone finally referred me to a chiropractor, and he was like all those things in one. So it's like, okay, sick. Like this is what I have to do. So I went to Life University to get my doctorate in chiropractic. Did the sports health science program and got my master's. And then currently, I've like really pursued athletics. Currently on a professional cycling team, and in the past, I raced triathlons at a pretty high level. And decided that this was like the population I really wanted to focus on in my like research because it's so underserved.
Yeah, that's awesome. And you've become this well-rounded practitioner for athletes, especially. You're just crushing it, and you know so much about human physiology that I just love picking your brain. And yeah, and not just human physiology, but taking it one step in the more complicated direction, but female human physiology, especially when it comes to training, uh, can be a huge can of worms to go down, right?
Totally. And like the deeper you get in the rabbit hole, the more complex but yet fun it becomes.
Mhm.
Because I have to pull a lot of your world in, like the
Mhm.
neurology and the endocrinology, obviously, and then just like apply all these worlds, which I understand now why people don't want to go down that rabbit hole, because it's a lot of stuff. So you gotta keep a lot of stuff straight.
Right, right. Well, where do we even begin with this topic?
I'm going to start on a positive note. So,
Okay.
the Olympics are coming up, and this is the first year in Paris that we've had equal representation of men and women. I think a lot of people don't know that, myself included. When just growing up in sports, I just like was like, okay, this is sports. Like I didn't realize that like women, like, like as a kid, like I didn't realize women were like underserved or like whatever. But yeah, this is actually the first year, 2024. But it's really cool to go to look at the history of the Olympics because Paris in 1900 was actually the first Olympics that had women, and only 2% of that Olympic field was women. So it's kind of cool that it's back in Paris this year. Um, and that is my point exactly that we're increasing as a population in the exercise phys world, but super under. researched. There's like a 2021 meta-analysis of 5,000 women, or sorry, 5,000 studies were included in that. And with 12.5 million participants, and this it was similar to a study that was 7 years earlier, and women only accounted for 34% of the participants, and only 6% of those studies were focused on women in isolation. So obviously, like hugely under researched, but yet we're 50% of the Olympic field now. So that's crazy to me.
Yeah, that's fantastic. And I didn't even realize that. I just assumed it was kind of like a Title IX situation where, you had equal number of men and women athletes, just like in college, or at least opportunities. Same for Olympics. So I didn't even know that.
Yeah, it's forced in college, and I say forced politely because I also respect the fact that like I see men's sports that are being eliminated, and just for the sake of having equal opportunity for women, and I don't know, I have mixed feelings about that. But in the pro field, you can see that with salaries, you can see, and I'm not going to speak on that topic, but it's not really equally represented. There's not really as many women, I guess, that wanted to be professional athletes, maybe, or that they were told they couldn't, or perhaps what I'm studying is that like they had issues, right? Like women have more stress fractures, women have lower iron, women have more autoimmune issues, women have more ACL tears, the post-concussive syndrome is higher. DVTs, POTS, PCOS, and like I could go on and on, that women are a higher presentation or have a higher presentation in like sports injuries, that we say we don't know what to do with, or we just don't treat it appropriately.
And would you argue that there are things that we can do about that, and once we can identify it, we can actually address it to make the playing field a little
Absolutely,
more.
yeah. Yeah, right. First step is like identifying like just the knowledge of knowing that it's a thing is pretty liberating, and then like chasing those issues, like keep asking why, keep asking like how is this a thing, like why does this happen, and not just accepting like a status quo.
Yeah, that's awesome. So, where why might looking at a female athlete, this might be obvious, but why might looking at a female athlete be more complex than looking at a male athlete? And what are the different considerations we have to take?
Hormones are wild. If anyone has ever been around women at an extensive period of time, they can understand that like the most obvious thing, and it's the joke, right? That their mood changes throughout the month, and what other jokes there are. It's true though. It's actually true. Like just quick example, estrogen and serotonin are friends. When estrogen goes up, serotonin goes up. Serotonin's like that mood boosting hormone. Whenever you rip the rug out on estrogen, serotonin goes down. So of course, like some of the stuff's like obvious when you like learn about it. You're like, oh well, of course that happens. But men have like more static hormones throughout the month. But those fluctuations in hormones make women women. That's why we get ACL tears at certain times of the month, because estrogens actually relaxes ligaments and tendons, and so that's one of the things. And before I go on, I'm not going to advocate, or I will advocate for training a certain way at a certain time of the month, but I'm not saying that women should ever be in a bubble. So just let me like foremost say that, because just because ACLs are really prevalent around ovulation, I'm saying like again, knowledge is power. So to know that, but there's certain things you can do to prevent them.
And so what might some of those differences be between the different phases of the cycle that we need to be cognizant of?
Yeah, so I guess I'll just kind of do an overview of the
Mhm.
cycle, and
Mhm.
then try not to get too sidetracked with that. Just use that as my kind of backbone.
Mhm.
But at day zero, when women get their period, hormones are pretty much are really low. We call this is the start of the follicular phase. We can break it up into more phases. People want to do four, people want to do two. I think I've seen more than that. But for simplicity, let's just do two today, and then we can do early follicular, late follicular, early luteal, late luteal.
That's
But
good.
follicular phase is days 0 to 14, and that's when we generally say it's the lower hormone phase. Estrogen starts to climb during ovulation, and that's when we see all these ACL injuries. But in the beginning, on day zero, day 0 to 7 is pretty much women's hormones profiles are most similar to males, and we say this is the best time to train. If you can plan a race, then that's great. Exercise testing, all the things athletically are best at that time. Versus ovulation, and then in the luteal phase, not as ideal. And again, I'm not saying we should not train or we should not race then or we should not do things. We should just know that that's a thing, that women can set, or more likely to set a PR in the follicular phase than in the luteal phase.
Mm-hmm.
And then luteinizing hormone spikes on day 14, and that's when we use as our metric of ovulation. If we really want to know when that starts, there's luteinizing hormone strips. There's like 49 cents a pop, and you pee on them in the morning. You can start at like day 10, and then end at like day 16, and that will tell you when luteinizing hormone is highest, and that's like the dividing line. And then after that, the luteal phase starts, and that's when progesterone is kind of the star of the show.
Okay. And so just for those who may not be familiar with, estrogen, luteinizing hormone, progesterone, what are these things doing to our body? You said kind of during day 0 to 7, that follicular phase, that's kind of when estrogen may be starting to spike a little bit more or start to elevate a little bit more. And this is when women are more physiologically related to men. So I guess what's going on in their bodies physiologically at that point? What are those hormones? What is that hormone doing specifically to the body, to the muscles?
Yeah, so estrogen is, and I'm gonna say good and bad just because for the
Mm-hmm.
sake of a podcast, and we're talking about exercise physiology, when really our body, it's kind of an innate thing that our bodies want to reproduce, right?
Mm-hmm.
So ovulation, again, I say all this politely. The only thing women are good at in ovulation is reproducing. That's what your body wants to do. You're not really good at as good as taking tests. You're not as good at doing exercise related things. But estrogen, so estrogen is the MVP of the follicular phase, and it preps the endometrium for attachment of that fertilized egg, right? It's all about reproducing. That's what, that's one of the four F's of like primal instincts, is reproducing. So, and then so some of the stuff estrogen does pertaining to exercise phys is it increases anabolism. It's anabolic. It helps building muscles. It helps strength, bone density, metabolism, protein synthesis, increases mood. Women are more confident when estrogen's high. I when I was studying this stuff, I had George, my boyfriend. I was like, tell me like how I really am during the time of the month, which is dangerous. Like I
Mm-hmm.
don't know if you're
That's it.
bold enough to do that.
It's a
Yeah, go
trap.
ahead. It was, but he's really honest, and I appreciate that. But he said like if I'm gonna start a fight with him, it's gonna be on day 7 when my estrogen is highest, because I'm like, I guess I'm most confident then. I don't know.
Uh-huh.
That was funny. But increased verbal skills, more insulin sensitivity. So right, like all those things I just described are positive things for exercising, right? I would
Mm-hmm.
say there's no negatives. Estrogen is also anti-inflammatory. It's glycogen sparing. As an endurance athlete, I like that. Like I don't want to say I like that, but it's advantageous that I can eat gels and have that glucose to metabolize, and I can still keep my glycogen stores high, and I can use fat as fuel better. One of the only things, or again, please, not one of the only things. I sound terrible there, but one thing that women are good at, or better at than men, are long distance swimming. So like the
Mm-hmm.
Catalina Island swim is one that women have historically won. Women have the I believe the English Channel swim, and then from Florida to Cuba, they're set by women.
Mm-hmm.
Um, so I think that's super cool.
Yeah.
And then one of the only drawbacks of estrogen that I've found, there's probably more, but one of the big ones is the increased tendon elasticity. So that's when we get those ACL tears.
Mm-hmm.
Yeah. And then progesterone is the MVP of the luteal phase. It changes the endometrium to the secretory structure, continues prep for the egg if it's implanted.
Mm-hmm.
Um, and then so it has a lot of negatives for exercise phys, right? It increases core temperature, muscle breakdown, it's insulin resistant, it increases fat deposition, it decreases protein synthesis, It affects aldosterone, which affects sodium and sweat responses. Um, but it is neuroprotective.
Hmm.
So we talk about the withdrawal hypothesis with concussions. So I think that's a really interesting topic. And there's actually some research on birth control during concussions that can be neuroprotective and decrease concussion symptoms.
Oh, interesting. And I don't know if we were planning to go into birth control, but can you just give us an overview maybe of how that cyclical nature is going to be maybe shifted or changed, or what the difference might be when a woman is on birth control?
Yeah, so birth control is going to kind of flatline the hormone. Like, right, I just kind of talked about these spikes, these like waves and troughs, I guess. And birth control is going to kind of level things out. Which there's definitely drawbacks to birth control for sure. But there is a few positives also. I mean, the major one, right? Like not getting pregnant if you don't keep track of your cycle. If you keep track of your cycle and you're eumenoric, it should be pretty easy to know when you can get pregnant. But if people don't want to do that, then birth control obviously does that for them. But there's different types of birth control. There's the combined hormonal contraceptions, and then there's also like a progesterone only. There's patches, there's pills, there's all sorts. So they all affect women a little bit differently, but overall it kind of flatlines things.
Hmm. Okay. Um, one of my favorite resources along the lines of this topic is a book that my wife had me read. It was called In the Flow by Alyssa Vitti. Do you know that one?
I don't think I've read that one.
Okay, you should definitely read it.
I
Um,
definitely will.
so she talks a lot about, and hopefully I don't get this wrong or misquote her, but she talks a lot about the four phases and how you can optimize your cycle, both from how you're exercising, what you're eating, how you're structuring your job, how you're interacting with friends and family, and like how to structure your social life to optimize the different phases of your cycle and kind of like. So I'm not sure if that's something, with your training experience, when it comes to exercise, especially, is that the way you might approach a female athlete and how you structure her training regimen, right, based on her cycle and your cycle maybe?
Absolutely. Yeah, that's spot on that you can kind of manipulate your cycle a little bit or understand your cycle and then like accommodate work, training, things like that.
Hmm.
Yeah, like some of the books I was reading that and research was talking about like when you should defend a thesis or when you should,
Hmm.
set your A race. And I think that stuff's super cool that there's opinions and strong evidence to back that up.
Hmm.
Um, Definitely.
Yeah, and I know she, like, even from a dietary standpoint, is soy good or bad, right? For certain people. And I think I remember her making the argument that specifically during the follicular phase, soy is not necessarily a bad thing because it might help with your estrogen production,
Yeah,
especially if that's something that historically you've had trouble with. However, that's probably the last thing you want to consume during your luteal
big.
phase, right?
Yeah. Yep.
So
That makes sense.
so when estrogen should be have already spiked and should be dropping, you don't want to like increase estrogen and like offset the balance of progesterone, right?
Totally. Yeah, I mean there's amino acids too. Like serotonin and estrogen are right directly related. And then like increased leucine intake can cause decreased serotonin and increased tryptophan can increase serotonin because tryptophan and leucine are competitive inhibitors.
Hmm.
So there's like some like, and I mean, those are just parts of protein, right? Like, if you just eat certain foods, like I think that stuff's super cool.
Yeah. Yeah, I think you would really appreciate the book. So shout out to that book. Um, and then there's also something, I don't remember if she talks about it, but there's something called seed syncing or
Yeah, I've heard of that.
Yeah, yeah. So, eating different seeds based on where you are in your cycle to optimize performance and things like that. But yeah, so a lot of cool stuff, a lot of cool resources out there.
Absolutely. I think that stuff's awesome.
Uh-huh. You mentioned getting a concussion when your progesterone is high, right?
Mhm.
So women are more likely to suffer with PCS if they've sustained their concussion during that phase. Is
Yeah.
that correct?
So it's like the withdrawal hypothesis is like, so progesterone, the way I understood it was progesterone is neuroprotective, so you might not have symptoms that day.
Mhm.
But as progesterone goes down, the symptoms start to appear.
Mhm.
Uh, so that's where the idea of like birth control at that time, to like a progesterone only birth control would help those concussion symptoms because you're kind of as you taper off, like, or theoretically as progesterone goes down, you're going to have more symptoms. So
Yeah.
if you give someone birth control, then hopefully you won't have as many symptoms.
Mhm. Is there are there any, I guess, cyclical repercussions that you see often after concussion? As in, do women's cycles get thrown off after concussion, and why do you think that might be, if so?
Yeah. Yeah, I've seen that. I actually haven't read, like, gone down that path, but I would like to see that. I know that that's definitely your world more
Mhm.
than mine, but I have seen like women get a concussion and they don't get their period for a while. Their immune system tanks. I had a concussion last year. My menstrual cycle wasn't disturbed, but I got like really really sick like a week after my concussion, just like a really bad sinus infection, but like
Mhm.
completely couch parked for like the majority of the week, which I should have been anyways, because I was concussed.
Mhm.
Um, but it was like, oh man, 1-2 hit. So like that, I've seen that too. Um,
Yeah. It seems like kids who are going through puberty and they get a concussion, it seems to just change things a little bit. Same thing if women just, or a man really, the hormonal changes that we can see after concussion because of that neuroendocrine relationship, pretty remarkable. So yeah, it takes a village to kind of rehab those people sometimes.
Absolutely, yeah. Yeah, want to definitely take that stuff seriously.
So, Dr. Smith, how do we actually, how might an athlete actually test herself for their hormones during each phase?
So there's a few different tests available. There's serum blood, there's blood spot, there's saliva, and there's urine. And then also matching those values or finding good research or good papers for to match that. I think it's really interesting. I've dug so deep for this stuff because when I found out that it was a thing, I kept digging. And then like the Merck manual versus like another peer-reviewed thing, like the ranges are kind of different, so I thought that was interesting too. But I tried to round all of them to come up with. I have a chart that I use, and it's a huge range, but I want to be kind of in the center. So, but yeah, so total hormones you can get from blood, and so that would be like luteinizing hormone, follicle stimulating hormone, thyroid, insulin. And then saliva test is what we want for free hormones and the diurnal hormones, steroids, vitamin D. And then a urine hormone, or sorry, a urine test would be the hormone metabolites, and like heavy metals and stuff. But like the free hormone hypothesis states that like the biological activity of a hormone is affected by the unbound, free, bioavailable form. So I personally am really interested in that.
Hmm.
So I do a lot of spit tests. It's also a little more convenient for me just to I send someone a kit and I'm like, you work with this company directly. There's like 2 labs that I use, and they can spit from home. Well, I mean, it's a certain day that you're supposed to spit. There's 2 days of the month that you spit to see in the different phases, and that
Hmm.
gives us the data, right? And if those numbers are skewed, then we know what to chase, or what is a problem for us, and we make amends.
And I guess a good follow-up question would be if a problem is identified, what is your approach to make amends to the issue?
it's always lifestyle, or I don't say always, never say always, but at this point, where I am with my career, it's more often than not lifestyle. And I can throw myself in this too, that
Mhm.
people that don't get enough sleep, they don't get enough protein, they're working out too much. I personally don't do a lot of caffeine, but I see a lot of women that do tons of caffeine.
Yeah.
I'm very caffeine sensitive, so I don't mess with that stuff.
Hmm.
Um, but I'm reading Matthew Walker's book on sleep right now.
Hmm.
I'm hoping
I
there's
love
some
that book.
snacks.
Yeah.
He's wonderful. I've listened to all his podcasts, and so I finally
Hmm.
like bought his book.
Yeah.
Hopefully there's more in the book, but I'm pretty sure it's just sleep more is the trick.
That's the gist. Yeah.
Yeah, go to sleep. So it's funny how like we go through all this research and all this schooling, and it just comes down to, hey, are you getting a gram of protein per pound of body weight a day? No, maybe you should try that.
Hmm.
Are you, making sure you have a little bit of protein before you go to bed, so your blood sugar, or sorry, a little snack of protein and carbs before you go to bed, so your blood sugar doesn't tank overnight?
Hmm.
Maybe you should try it. Like, um, I had the privilege to test Super Sapiens. It's a continuous blood glucose monitor, and that was pretty profound for me because I thought my nutrition was dialed. I knew my sleep was ratchet, but I thought my
Hmm.
nutrition was good, and I was actually seeing some big dips in the middle of the night. Um, my blood sugar got pretty low, and I would like wake up and I didn't know why because my sleep was affected by the nutrition. Because right, it's all related. So I fixed that by I just have a little snack before I go to bed, and things got better.
Nice.
But you think you're eating enough, and think you got your macros dialed, you think all that's fine, but timing matters too, right?
It's a lot to know, a lot to consider.
Yeah.
Yeah, I mean that's awesome. And uh yeah, lifestyle is huge. And I think I'd be a little remiss if we didn't talk about endocrine disruptors and maybe some other things in our environment that may be throwing off our cycles.
Yeah, I'm definitely going to go back to kind of what we just talked about, but still on the same page of things that disrupt. Like just the sleep wake cycle, right? We want
Hmm.
cortisol to be high in the morning, and we want adenosine to be low in the morning, and then those switch at night.
Yeah.
So that's one of the things when I do the hormone testing. If I see a high cortisol level in women in the evening, I know they're not going to fall asleep well. I'm guessing that they're doing some afternoon coffee or like whatever Red Bull before they work out in their evening or whatever. And I tell them no caffeine. Like I'll say like you can have maybe a little bit in the morning, but that's it. Like you got to cut that stuff. Because and then caffeine is a adenosine, a competitive inhibitor to adenosine. Caffeine is not an endogenous substance. We don't have caffeine receptors, right? We that plugs into adenosine, and that's really important for that sleep wake cycle. I know a lot of people want to do melatonin before they go to sleep, but melatonin's a lot of these supplements kind of frighten me because they're not third party tested.
Right.
Pretty much the only supplement company I personally advise for is Thorne.
Hmm.
Um, and it's third party tested. So I actually don't care what people use as long as it's got a lot of testing for it. Because there's some studies with like melatonin that it's just like not the right dose. It's been like that with whey too.
Hmm.
So you want the correct dose to know what you want. And then melatonin, I said aromatase inhibitor, the rate limiting step to convert testosterone to estrogen in that huge cholesterol hormone pathway, um, is aromatase. And when it's inhibited, then we get this like stifling of estrogen
Hmm.
with melatonin. So if we don't even know what dose we're doing, and right, I don't like that scenario.
Yeah.
Um, but those are like some things I think of off the top of my head with like
Hmm.
not necessarily endocrine disruptors, but like maybe, um, and then just
Well,
not having macros dialed.
yeah. And I think of some of those potential aromatase inhibitors could be like all of these like senses that people use,
Yep.
right? Like these
Yeah,
car
the candles, the
fragrances and the fragrance, yeah,
oh,
exactly.
I hate those
Perfumes. Yeah. And um
deodorants, like just rubbing scents in
right,
your armpits, like gross.
right, yeah. After like I and one thing that I found interesting was it's not always what you are necessarily consuming or using, but what is your partner doing too? Because if they're using like exogenous hormones, and then you're cuddling, and whatever else you do, chances are those things are going to be transferred to you. And now you've got whatever your partner is treating themselves for. Now you are absorbing that as well. And that's going to throw off your balance, which you probably didn't need extra testosterone, or partner doesn't either, probably, but deep down. But now you're taking that in too, which is going to totally throw off your endocrinology. So it's, yeah, a lot of things to consider, really.
Yeah, excellent point. Yeah, like fabric softeners, like all the
Fabric
things.
stock. Yeah.
That's also really good to bring to attention to people, because I think like maybe you and I think about that, but I forget to mention that sometimes, because it's like just something I've done for so long, like
Mhm.
unscented things, and but then yeah, that's great. I'm glad you brought that up.
Yeah. Yep. So, I mean, the endocrine system can be very tricky and very nuanced and easily disrupted. So, it takes
Yeah.
somebody like yourself to really get into the nitty gritty with each individual person.
You made me
But
think
yeah,
of your brain on birth control. Have you read that book?
I think because of you, you recommended that to
Yeah,
me.
okay, like that might be like those type of books are what I absolutely love, that they'll say
Yeah.
a thing and they'll reference the research. I love
Yep.
that.
Hmm.
And that book is pretty trippy because it talks about the difference in birth control and how men like perceive. So you
Hmm.
get into like the pheromones, which
Yeah.
pheromones are, I mean, that might be one of the coolest topics on the planet, I think.
Yeah.
Um, that like just being near someone that like changes like what I think of them or how I observe them, or like how I feel about them, and I'm
Hmm.
not even making contact with them, or I'm just in close enough proximity to like maybe smell them, right? That's
Yeah.
what we think of, that Jacobson's organ or whatever.
Right.
um,
Right. And here's kind of a side note, but I was just talking about this with my wife today. But when your partner becomes pregnant, like my wife is now pregnant, my endocrinology is now affected. Statistically, my testosterone is more likely to drop. So now it's going to be harder for me to keep on muscle mass, and my energy is going to be lower. Like, shoot.
well, if I may I
Yeah,
challenge that
challenge
study?
me. Yeah.
Okay, so I read that study too,
Uh-huh.
and I saw that, and I was like, well, damn, like what happens when like, like, and I'm just gonna make a scenario that like you're pregnant, like you may or may not be comfortable being pregnant, like you're not sleeping well, and then your spouse isn't sleeping well because they're
Hmm.
tossing and turning, and then they're losing sleep, and then acute sleep deprivation tanks testosterone too.
That's true. That's true.
So I'm like, did you just get the 1-2 punch? Maybe. Like
Yeah.
I don't know. I need more research on that stuff. Like I need to
Yeah.
know, is it sleep? Is it pheromones? I mean, pheromones are super cool, so I'm almost banking on that.
Hmm. Yeah.
But sleep, right? Like,
Yeah. But so much more to know. So much more
yeah.
to dig. But yeah, luckily to her, unfortunate, whatever. I still sleep very well. Sleep through the night, and she's, tossing and turning. But anyway. Um, yeah, so we are coming up on time, Dr. Smith, but I wanted to make sure that we still have the space to give any closing remarks or any final thoughts on the topic.
I think my only closing remark and message is to not treat women like men. Like if you want
Mhm.
to coach them like that or whatever, and it might go fine. But if it's not going fine, then you might need to change that rule. And the same thing with like medications or anything like that. It's not a one size fits all thing.
Mhm.
So I think it's important. Just knowledge is liberating, and the more people know, the more people will make educated decisions on stuff like this.
Yeah. And I'm hoping that this podcast, your knowledge is going to spread and more people will be aware, and the world will be a better place, especially for female athletes. So,
Thanks, Dr. Joe. Thanks for hosting these podcasts.
of course, yeah, hopefully you like them. Hopefully the audience likes them. And, I think it's awesome to get to interview people like yourself who are doing super cool things, and, you know, things that I'm not necessarily as involved with, but still we can find exciting things that we can really put our minds together and talk about here. Um, and I do want to just reiterate there were three great books that we mentioned today. So you mentioned Why We Sleep by Dr. Matt Walker.
Mhm. Yep,
You mentioned Your Brain on Birth Control. Don't remember the author.
I don't
Um,
either.
And then I mentioned In the Flow by Alyssa VD, I think is her name. So if you're listening, those are 3 great resources within the topic that we covered today. So check those out. No affiliations there. So no. But anyway, thank you again for coming on today. This was great. Always lovely to talk to you.